literally sell their car to be able to afford Lyme treatment, because it's either that or they're gonna die. I mean, that's how critical it is. And some people don't have anything else to sell or to give. And so what do? I've seen suicide. I've seen people commit suicide because they're so sick, nobody's helping. They think, what's the point? And they don't have the money for treatment. I've seen, I mean, it makes my eyes tear up to tell you the things that I've seen because of Lyme disease. And the traditional world, just, they don't get it. They don't get it at all. Unfortunately, our doctors, our nurses need more education. Our insurance companies need to be able to cover these tests, because who can afford that? Most normal families are struggling anyways, and they cannot afford the testing, number one, and then they can't afford the treatment. Some of these treatments, I mean, I took care of patients where they would leave and have to have treatment at integrative practice at least 3 times a week, and they were out thousands of dollars. And then when the money from that card that they sold, that they're now taking the bus to come to the clinic, that money runs out and they're not well, then what? Then their mental health declines, and it's just it's a downward spiral from there. So that's why I advocate, because number one, people need to be able to get treatment. That's just the bottom line. And I get so upset because they can't afford it. And I hate that. And you know, we see all these other programs for this and that and the other, and there's nothing for somebody that has chronic Lyme at all. And so I hate that for these patients, because they are miserable. They're sick. They're so very sick. And when the right testing is done, you can look at their labs and you can see they are so incredibly sick, but nobody could put the puzzle pieces together to actually give them a proper diagnosis, because these doctors aren't trained that way.
That's right.
That's not how they're trained. So that's why I come on. That's why I advocate. I've known Christina since the beginning of, you know, I love her. I worked at a clinic that got people well. Unfortunately, some people couldn't afford to get well. It was
very expensive. Yeah.
So expensive. And the clinic is cash pay. Most of them are, because their insurance does not cover the kind of treatment that you need to get well from Lyme, which to me is mind blowing. I mean, they are so incredibly sick, but they don't pay for it. So I appreciate you advocating for us, especially me being in the healthcare world. You know, I hate to go and see these patients that are so incredibly sick to the point of suicide. They just don't want to live anymore, and we can't help them. It blows my mind. So I appreciate it. So thank you very much.
Love you so much, Cristy. And also note, Ryan, she is a constituent in your district.
Perfect. Nice to meet you.
Yeah.
Nice to meet you. Yes. Thank you, guys. I'm sorry I have to jump off. I have so many patients today.
We love you so